Yeah.
Okay. Good day, everyone. My name is Daniel Ramirez. I'm a physician at Fundación Santa Fe, Bogotá, in Colombia. Today, I'd like to share with you a research titled Analysis of Radiological Markers in Normal Pressure Hydrocephalus and Their Association with Postoperative Outcomes. Um, no. Normal pressure hydrocephalus, or NPH, is a condition marked by enlarged ventricles but with normal intracranial pressure. It's usually present with the classic Hawkins triad, gait disturbance, cognitive decline, and urinary incontinence. Diagnosis is made through a lumbar puncture with clinical assessment before and after. Radiological signs like Evans index, callosal angle, and DESH help support diagnosis, but their predictive value remains uncertain. That's why we conduct this study. We designed a retrospective cohort study from 2016 to 2024, including patients with NPH who underwent ventricular or ventricular peritoneal shunt surgery, and we analyzed three things: demographic data, pre- and post-operative outcomes at 1 month and 1 year, focusing on gait, cognition, and sphincter control, and preoperative MRI findings. Here, the radiological signs we specifically evaluate in our study: the callosal angle, DESH, temporal heart enlargement, Evans index, periventricular white matter hyperdensities, ventricular enlargement, and absence of flow in the aqueduct. Now let's move on to the results. We found that over 60% of patients improved clinically both at 1 month and 1 year after surgery, especially in the first month. Improvements were seen across the triad, the Hawkins triad, gait, and
You are muted, Doctor. Doctor, you are muted.
Lost your voice.
Dr. Daniel, unmute, please.
Okay.
We lost Dr. Ramirez.
Okay, can you hear me?
Yes, we
You
can
lost
hear
your
you, but
screen.
we lost your screen.
Okay. Yeah. This is technical problems. Okay. And now, in the conclusions, we can find that Evans index, callosal angle, and DESH are useful for diagnosis, but their ability to predict clinical improvements is limited. And we find that periventricular white matter hyperdensities were associated with gait improvement, Evans index, gait in gait improvement, and DESH with cognitive recovery, suggesting their utility in a specific context. And finally, we want to share with you this phrase from Dr. Salomon Hakim, who described this syndrome in 1965, that is, requiring from oblivion at least some of those patients who, in as much as this syndrome has not been recognized, previously has been diagnosed as hopeless cases. Thank you very much.
Thank you very much.
I think excellent. Asad and Ahmed, do you want to wrap it up, please? Because Ahmed is going to score today's presentations, and tomorrow we're going to have more presentations with scoring, and depending on that, first, second, third would get prizes. So, do you want to wrap it up, Ahmed and Asad?
Okay, thank you for all the speakers. It's a very nice presentation and abstracts, but due to limited time, it was not cannot do all the information. But maybe we can another time we have more details about this abstract.
I understand two papers are not presented.
Yes, Mehmet,
Yes.
two people did not turn up. So
Okay, good. Thank you.
Asad, your
Thank you very much, everyone. It was a very nice presentation. I'm sure this is just the tip of iceberg of all the hard work that you do behind the scenes. So well done, everyone, and keep focusing and continue your hard work. Hope to see you sometime soon.
Okay, Mehmet, do you want to comment on the quality and the type of presentation of young neurosurgeons there?
Yeah, actually, it was very nice to see all the young people eager to participate and present their nice scientific works. Actually, there was some connection problems, but anyway, they were very high quality. I am very glad to hear them. Thanks a lot.
Excellent. I think you're ready to start, yeah? If you want to call the moderators.
Thank you. Thank you so much, Dr. Ahmed and Dr. Afet, for hosting this for us. Now, moving on with our program, we have a neuroendoscopy session, and I would like to